Good morning, everybody. Welcome to Surgery Grand Rounds. There is no commercial support for today's program. The speaker and planners have disclosed no relevant financial relationships with commercial interests. If you have a question for our presenter, please hold until the end of the talk. If you're attending virtually, you may enter your question in the Q&A section. Also, a link to the evaluation will be shared in the chat section toward the end of the program. If you are ABS certified and want NGHS to report your CME credits to ABS, please fill out the evaluation and give us permission to do that. And now it is my pleasure to introduce our speaker for this morning. Dr. Devin Smith began his journey at North Georgia College and State University, where he earned a Bachelor of Science in Athletic Training and was commissioned as an Army officer. He went on to pursue his passion for medicine at Mercer University School of Medicine, with plans to pursue a career in general surgery. Dr. Smith brings with him a strong foundation in service, leadership, and dedication to patient care. Please join me in welcoming Dr. Smith.
Can y'all hear me? That's not too loud, is it? I know my voice carries, so I'll try to whisper. I'll be going over this morning a survey of general surgical history. As you can see there in that slide, this is a picture that we'll kind of come back to later on in my presentation for those of you that may have seen this before. Disclosures, I have no financial disclosures. I am a poor resident, as you all know. I eat white bread sandwiches and bologna, so I'll put a cup out at the end if y'all want to send me some tips for the weekend. Learning objectives. So we'll provide a brief overview of surgical history, and then I'll also familiarize oneself to some of the key historical contributors of the field. We'll do so kind of following this template. We'll first touch base on some ancient surgical history. Then we'll play kind of a little game of surgical guess who, if you will. I'll touch base on three key paramount revelations in our surgical field that allow us to do what we do today. One being hand washing, two being germ theory and antisepsis technique, and the last being anesthesia. And then we'll conclude with our presentation. Just like any formal document, we'll have a preamble. Probably the most famous one you'll recognize is the Constitution, We the People, but we the surgeon, I feel like better fits here, and I think Isaac Newton said it best. You know, if I've seen further, is by standing on the shoulders of giants. So with this presentation, I'm trying to pay homage to our history, also forefathers in the field that kind of allow us to do what we do today. So our first evidence of surgical treatment actually took place here in Indonesia. It's not relatively a known place. There is some rainforest areas. They have a Kutai National Forest area there, also home of the orangutan, if you did not know that. But key here is this. This was the first evidence of surgical treatment. I'm sure you've all heard like Mesopotamia type time frame and things of that nature being the first. Well, this individual here, and that's if this works, this is an artist rendition, and as you can see here, and then here is evidence of amputation, and this was 33,000 years ago. Up until that point, we thought surgical history, in essence, began around 7,000 years ago. So there's 20-something thousand years of a gap that now anthropologists have to actually ascertain, and it makes me wonder if surgery history itself was not even before this. I don't think this was the first representation of an amputation. And as I said, 7,000 years ago, up until that point, was actually in France. Down there at the bottom of Boutiers-Belancourt was the region that a French farmer was found buried with evidence of a amputation, so 7,000 years ago. And this is actually a 3D representation of that. The arrows are just pointing to callus formation. That's how they were able to kind of ascertain that this was indeed an amputation and not a traumatic one, as you don't see jagged edges of bone or anything of that nature. This guy was actually buried with these rudimentary instruments that likely performed the operation. So as you can see here, oh, sorry, it now works. Right here is a schist axe. So schist is the stone used, and they have a rudimentary like wooden handle. And then this is a flint pick that he was buried with. He also had a lamb at his feet as well. I don't know what the lamb was for. Couldn't find out why. Maybe it was paying his debts to go to the afterlife or give him feast on his travels. But you could imagine performing surgery with those rudimentary instruments, how that must have felt. As we progress through history, this is just a brief little timeline going through as the Stone Age. You also have evidence of trepanation. The Mesopotamian region was also during that kind of time frame, Fertile Crescent region, where we thought surgical history was actually started, and it also has the first codified laws dealing with medical, in essence, malpractice and things that we can think of today. And then also, of course, the Egyptians as well. And then that picture here is just showing kind of the beginnings of orthopedic treatment. As you can see, a metal rod implanted in the knee region here. So trepanation just came out, battle, blunt force trauma is what they thought it came from, but this is dated in BC times, and as you can see here, they would burr holes into the head, believed to either relieve pressure or headaches back in the day. This is the code of Hammurabi here. It's actually Mesopotamian region in Babylon times. I have highlighted here is, which I found interesting, if a physician was to make a large incision with the operating knife and kill him, or open a tumor with the operating knife and cut out the eye, his hand shall be cut off. If we lived by that code today, just my short time in the STICU, I don't believe I'd have any hands left. So it's a good thing we don't have that today, but this was also the first representation of to held physicians accountable. It also held veterinarians accountable and other people in their culture accountable. And that's just a representation of the actual monument that was found. So we've all played this game growing up, Guess Who? So this is where we'll actually get into the meat of the presentation. And we'll first again touch by hand washing, and we're going to look at the father of hand washing techniques. So as you can see here, quite a lot of steps in how we sterilize our hands today before our surgical operations. Just there's 9 little simple steps, but it's something that I feel like we take for granted today as physicians. It's so ingrained in our heads, we find it actually preposterous if you do not do this. But it wasn't that long ago to where this was actually considered preposterous of washing the hands. People didn't think there was a need to it. And actually in 1847, that's when our next character that I'm going to present actually determined that hand washing is of benefit. So that is this gentleman here. This was Mr. Ignaz Semmelweis, or the father of hand hygiene. He was born in Hungary in 1818. He graduated from Vienna Medical School in obstetrics. Other notables from that was Sigmund Freud, Gregor Mendel, and also Erwin Schrödinger was noted to attend this prestigious university. He worked at the Vienna Hospital, where his astute ability of observation led to discovery far advanced for his time. I asked you there, what was that observation? And a hint, he was also known as savior of mothers. So in his line of work, puerperal fever or childbed fever, which is what we kind of know today as postpartum infections, was rampant and was very important clinically as he's seen this in his practice, but there was no real way to treat it at that time. Antibiotics were not around, and with that being said, their thought process with this was it caused by something in the air, if you will. That was the miasma theory that we've all heard, just something floating around in the air that causes it, or noxious air or bad air. They also thought it was just endemic, part of their everyday culture, society. It was just part of the job, nothing really to do about it, or just by will of providence, meaning just benign right, that was God's will in essence, and if you had that unfortunate event, then so be it. And the only really cures for that time was bloodletting. There was nothing else they could do other than just supportive care. And at some institutions during that time, childbirth mortality for the mother was as high as 30%. And I just have down here, our current death rate or mortality for childbirth is 0.02%, just to compare. So practically 1 out of every 3 mothers died during childbirth back then at some institutions. So he was on the front lines as he treated these patients daily, and he cared deeply for these patients. And when they died, some of their best work at that time was trying to perform post-mortem autopsies to determine causality as well as the etiology as to why these women were dying at such a high rate. It is from these autopsy findings that he would eventually determine a possible answer as to why the women were at such high risk of dying during childbirth. He did this in first twofold. So first portion was in his maternity ward, he was able to make a profound observation at that time. And that was just by way that the hospital was set up. So one ward was ran by midwives. The other ward was ran strictly by physicians and medical students. And as you can see here, the physician and medical student ward had a mortality rate doubled at that of the midwives. And he asked himself the important question as to why. That why was very important because he realized that during his time of monitoring these patients, it was common for physicians and medical students during that time to perform autopsies prior to their morning rounds. So they were doing autopsies on the postmortem patients and going to then doing morning rounds without any evidence of hand washing. There was no cleanliness. There was no antisepsis techniques present. They were just carrying those germs to those patients. And these are the same women that died of that infection. Next was the unfortunate accident that claimed the life of his friend and colleague, Dr. Kolechka. He was a pathologist that worked side by side with Dr. Semmelweis. His friend was working with a medical student that accidentally cut him while they were performing an autopsy, and he died of profound sepsis. The autopsy of his friend, though, revealed findings that were consistent and similar to the women that he's been treating, and that's what really allowed him to make the connection that it was something that was being transmitted from person to person and not just something spontaneously generating in the air. So he called it death particles at the time. Obviously, he couldn't see bacteria or anything at that time, but today the common culprit would be group A strep infections, as I have a picture of that there. So, as I had mentioned, he determined at that time his hypothesis was that they are treating the postmortem dead women, picking up the death particle, and transmitting it out throughout his ward. So, with that being found, he introduced the simple concept of hand washing. And during that time, he utilized a solution, what we know today as Dakin's solution, to where all medical students and physicians must wash their hands until they became dry, and the smell of the cadaveric smell was gone from their hands, or that miasma theory that they thought about of just noxious or bad air. So at the end of 1 year, the maternal mortality rate during childbirth dropped to 2.4%. So that was 16 and 7%, as I alluded to previously. The year was 1847, and that was prior to any germ theory that was there. So this was kind of before his times. And unfortunately, with this new data, he was mocked by his peers. How could the unholy hands, as they put it, of holy physicians be attributed to increased risk of death? That was a very far-fetched idea, and they didn't know about bacteria. So obviously, his peers mocked him. They actually ran him out of Vienna, and he spent the rest of his life practicing in Budapest at a city hospital. He did eventually write a book on this concept, the etiology, the concept, and prevention of puerperal fever. But this too was also marked. Unfortunately, he did succumb to his death. He was attributed to be either mentally insane, we don't really know, or was it dementia, but he did die in a mental asylum. So with that being said, our next player of the game is kind of responsible for germ theory, if you will, which laid the groundwork for a future surgeon that I'm going to talk about. I don't know who that is. That is Louis Pasteur. He was born in 1822, died in 1895. He was noted for a lot of important contributions to the medical field, as well as science itself. But perhaps what is of great mention here is the disproof of spontaneous generation of germs, which he did so with this simple experimental technique here. This top one is disproving the idea that air can get in. So if you heat the flask up here, it does kill off or sterilize the fluid, but it does allow air to come in and go down. But the neck here traps particles that will just fall out in the air. And then obviously it doesn't cause any bacteria to be present. If you go down to the next one, well, the opponents of this was like, well, you just sterilized and killed everything off in your fluid when you boiled it. So what he did then was break the neck off, and then obviously it grows bacteria from things being present in the air, the microorganisms that they really didn't know about. And then this last one just disproves the air, meaning that they tipped it on its side and allowing air as well as the particles to be in contact at the very tip of this flask. And again, it became putrid or grew bacteria, proving that there was something or inoculum in the air that was causing bacteria to grow in that fluid and therefore not being spontaneously generated. Again, that shifted the focus of miasma or bad air to actually microorganisms as being a cause of disease. He was also attributed to developing the first rabies vaccine, but he also, with these studies, had a profound influence on our next guest that we'll be talking about, which is this gentleman. So this is the father of modern surgery or antisepsis technique, Dr. Joseph Lister, born in 1827 and passed away in 1912. He was a British surgeon attributed to the father of antiseptic technique. He trained under James Syme, which was a prominent surgeon back in the day in Edinburgh. If you remember amputations like the Syme's amputation, that's the same surgeon that developed that technique as well. And this is just a picture of the infirmary itself that he trained and worked at in Glasgow. Lister, in his surgical practice, he was not only an acclaimed surgeon, but he was a highly analytical scientist. He had the fortunate advent that his father, J.J. Lister, was a man in many things. He was a wine merchant, sold various goods, but his father also was a scientist and actually improved the design of the microscope through improvement of the objective and achromatic lens to where there was better resolution that could be seen with what was being visualized and magnified. He actually published on that on some properties in achromatic object glasses applicable to the improvement of the microscope. With this being said, Lister had all the most cutting-edge technology at his hands in order to be able to perform analysis of his patients. This is not of his patient here, but this is actually a representation or rudimentary drawing of bacteria that he did see as he was recreating one of Pasteur's experiments. As I said, Pasteur did have a marked influence on his work. It is from that work that he was able to hypothesize that microorganisms in the air were actually the direct cause of wound infection and suppuration. So that led him to speculate that placing an antiseptic shield between the wound and the air itself would limit infection. He knew something needed to be done because during his surgical wards from 1864 to 1866, he documented 35 amputations and 16 of those patients died, so right at a 50% mortality rate. With that being said, At the time, there was ways to, what they thought they could treat would be filtration, which obviously would not be able to be performed for a surgical wound. Heating was not a considerable idea, as you don't want to burn the patient to prevent infection. But chemical treatment of the wound itself could be a feasible option. The chemical chosen at that time was carbolic acid, or phenol. It's a coal tar derivative that actually was utilized in shipping wood as well as like railroad ties in order to prevent rot. He utilized a concentrated version of phenol, and then he was able to utilize that on patients. Unfortunately, his first endeavors into this, one of his patients did die. He was trying to treat an abscess. And with that being said, he decided that he would only use the solution for those with compound fractures. That way, if they failed treatment, the treatment would be amputation, which already had a high mortality rate. And as you can see there, that's just the simple structure of phenol, not to give you scares of organic chemistry. That's the aromatic compound there. But it works from a antibacterial perspective, as if we remember, like dissolves like. So that benzene ring will intercalate with predominant gram-positive bacteria, which, as we know, staph species are the most common cause of surgical site infection. So it intercalates with the wall and then subsequently causes dissolution of the bacteria itself. With that being said, he was also, sorry, I think it went ahead too. So he treated these patients with this solution and eventually gathered enough data to publish his findings in the Lancet. This is his paper that was originally published on a new method of treating compound fractures, abscesses, etc., with observation on the conditions of suppuration. So he gathered 11 cases and treated it with this carboxylic acid technique, and he only had one fatality. So that was a 9% mortality rate. And you remember, prior to that, half the patients died if you had a compound fracture. So this was pretty revolutionary for the field of surgery. He was also key in implementing the use of clean surgical instruments. So he sterilized those in an acid solution that he created. He also realized that porous handles were not good for surgical instruments, so he stopped the use of that, which we don't see anymore. He also advanced techniques of ligating arteries, where his first studies were done on horse models, and then he took that to human models, and he actually utilized those sutures to be soaked in a solution for an antiseptic technique, and he also was a proponent of having that suture being within the body and not outside the body. And then he also had the fortunate event to witness the advent of anesthesia, and he was a proponent for a huge paradigm shift in surgical technique at that time. If you remember, prior to anesthesia, a surgeon was famed for his speed and his skill, which we'll address later on in this presentation. So everything had to be fast to minimize pain to your patient. With him, he was quoted as saying, "Anesthetics have abolished the need of operative speed. They allow time for a careful procedure. Adding success depends upon great attention to detail." So he was kind of ahead of the game of slowing down the operation in order to be safe and also gain further knowledge about operative technique. And as you can see here, this was like a picture on my original slide. This is the actual spraying system that he created, rudimentary. So there was a foot pedal that he could spray intermittently throughout the operation in order to help sterilize the air, which he thought those microorganisms were in, to help inoculate the air and prevent inoculation of the wound itself. And then lastly, we're going to move on into the father of anesthesia, or the controversy thereof. This first gentleman that we'll discuss is Mr. Horace Wells. He was born in the early 1800s in Hartford, Vermont. He was actually a dentist by trade, and he trained under Dr. Nathan Cooley Keat, which was Harvard's first dean of dental school. And then he eventually established practice in Connecticut. He also taught many students. Two of his more prominent students was Dr. William T.G. Morton, who we're going to discuss in just a few minutes, as well as Dr. John Riggs. And then Riggs was famous just because he actually came up with Riggs disease, which is what we know as periodontitis or gingivitis, but the late stages of where you actually had suppuration coming from your teeth. He wrote a small book on an essay of teeth, and these are quotes from him. So he recognized that teeth needed to be cleaned with the brush, which as today we find kind of silly, but back then that was very important. He also understood that there was nothing more destructive to teeth than a compound sold at nearly every corner on the street under the name of candy, which we've heard our mom and grandma and all that state to us as well. We need to stay away from sugar to prevent dental caries. He understood the importance to preserve primary dentation and follow that up with saying the most important operative treatment that a dentist could perform was the simple operation of filling teeth. And he progressed that field as well. This is just a representation of his work. So that is from the Yale Medical Library. That is his short book that he posted on and wrote as a proponent of his field. So how did he become the father of anesthesia? Well, he was distressed about the pain that patients underwent. As you can see there, you just had someone holding you in place as a dentist grabbed your teeth. There was really nothing in place to prevent pain at that point in time. He actually was quoted as saying he was deeply impressed with the idea that some discovery would yet be made by which dental and other operations might be performed without pain. And then as fate would have it, Mr. Wells had a profound observation. So his friend and colleague invited him for a get-together. So Dr. Gardner Quincy Colton put on a grand exhibition of the effects by inhaling nitrous oxide, exhilarating or laughing gas. So this was a public event which he had took many volunteers from the crowd, and they were offered to take a hit, in essence, of nitrous oxide, and the crowd would watch your spectacle unfold before the stage. So Wells volunteered, and according to his wife, made a spectacle of himself. However, there was a guest in the crowd, Samuel Cooley, which inhaled the nitrous oxide and gave Wells the idea that laughing gas could be used as a potential anesthetic. So this next slide just demonstrates that. So this is an artist's rendition of Mr. Cooley inhaling the nitrous oxide, and I don't know if he was doing the jig or jive or whatever popular dance at that time, but if you denote here, his right knee has a laceration on it, is bleeding, and Mr. Wells down here in thought observed that he had this happen and had no idea it happened. So he connected the two of like, well, this guy didn't feel pain. He obviously has a large knee laceration that didn't even feel it happen under the influence of the laughing gas. So having witnessed that, he's decided that he must try this. So like any good scientist would do, he decided to have his wisdom tooth extracted underneath the influence of nitrous oxide. So he inhaled that gas, and his former student, Dr. Riggs, extracted his wisdom tooth. When asked about his pain perception, he quoted it as the greatest discovery ever made. I didn't feel it so much as the prick of a pin, a new era in tooth pulling. So he was very excited, obviously, for this because he knew that this could revolutionize practice. So with the help of his former student, as I mentioned, Dr. Morton, who was training at the time in Massachusetts, he organized an event with Dr. John Collins Warren, who was the chief of surgery at that time in Massachusetts General Hospital. As I have pictured there, that's the ether dome that they performed this so-called experiment in. Unfortunately, to Wells' avail, when the gentleman that was going to undergo a tooth extraction inhaled his nitrous oxide, in Wells's excitement to show this, he removed that too soon. And when he went to grab that tooth, you can surmise what happened. His patient screamed out a blood-curdling roar in this amphitheater in essence, and it echoed throughout. Unfortunately, he was tagged a charlatan, a fake, they said a humbug affair, if you will, and ran him out of Massachusetts. Well, further talk with the patient, the patient could not recall the painful event. So it actually did indeed provide some form of anesthesia. He just didn't have him induced fully at that time. Unfortunately, with all the ridicule and mockery, it did force him to close down his practice. And in 1845, he actually abolished his practice and gave it to his friend, Dr. Riggs. Mr. Wells, he continued working with anesthetic agents to include nitrous oxide, ether, as well as chloroform. But again, unfortunately, he became addicted to chloroform. He was actually thrown in jail because he threw some acid on these two homeless women in the street. It's because he was crazy or high on chloroform. Unfortunately, that did lead to his imprisonment, and when he went home to gather his things to go to jail, he snuck some chloroform in and actually committed suicide in jail by cutting his femoral artery in the tub. He never realized that he was actually going to be recognized for his anesthetic contribution. They had just voted on this prior, but obviously back in that day it was snail mail. Before he could witness his recognition, he had taken his life. But the medical society at that time did recognize his contributions to anesthesia. Which leads us to next person in play that they attribute to a potential father of anesthesia. This is his student, Dr. William T.G. Morton. As you remember, organized this first event for Dr. Wells. He, however, utilized ether, actually with orange oil added, which he named Lethion. And underneath this, as you can see here, that gentleman there is Mr. Morton, and this is the chief of surgery, again, performing an operation under ether as everyone's looking on in intent. That was a success. The ether kept the patient sufficiently underneath anesthesia and induced. The operation went smoothly. There was no screams of pain. And this obviously changed the surgical forefront as news of this spread widely and fastly. It made it across seas to Europe as well. There was a new revolution in surgery as we were going to be able to eradicate the pain aspect in order to perform an operation. This gentleman is also in the running of people to be attributed to the father of anesthesia, and that is Dr. Crawford Long. Dr. Crawford Long, he was born in the early 1800s as well. He was actually born in Georgia, Danielsville, Georgia, which is not too far from here, and actually established practice in Jefferson, Georgia, which if you're from here, that's just right outside of Athens. He retrieved his medical education in Pennsylvania as well as Kentucky, and then went on to do surgical training in New York, and then returned to Jefferson to establish practice. This is a rebuilt image of his office as it was dilapidated and had to be remodeled, but is actually a museum in place today recognizing his feats. He, too, went to these frolic parties, if you will, and he witnessed these individuals and also developed the hypothesis that nitric oxide or ether could be used as a potential anesthetic. He tested his hypothesis in 1842, so that was approximately 4 to 6 years from earlier than the other contributors I just mentioned, on a Mr. James Venably, who also had a tumor on his neck, and it was removed pain-free. Mr. E.S. Rawls was among the attendants and actually notarized the event and states, "I was present. I witnessed Dr. Crawford Long cut one tumor from the back of James Venably's neck, and that he was under the influence of sulfuric ether when the operation was performed. Mr. Venably did not show any signs of pain when the operation was being performed and stated after the operation was over, he did not suffer the least degree of pain from its performance." Unfortunately, he didn't publish his findings until 1849, and he published those in the Southern Medical and Surgical Journal. He also presented findings in 1849 to the Medical College of Georgia. However, he did not care about fame or prestige with that. He was quoted as said, "My only wish is to be known as a benefactor to mankind." So he served his community in Jefferson, Georgia with pride, and he actually died giving aid to a woman in childbirth where he was suspected he suffered a heart attack during that procedure, but did direct her care until he could be cared for. And he passed away in 1878. This is actually a statue that was erected for Dr. Crawford Long and his achievements of anesthesia. As I said, news spread fast. And in Europe, with the advent of anesthesia in America, the first public operation utilizing modern anesthesia was also performed with ether at the University College Hospital. This is Dr. Robert Liston. He was attributed to performing that operation. And his comments at the time, "This Yankee Dodge beats mesmerism and hollow." That Yankee Dodge referring to the demonstration of anesthesia actually performed in Massachusetts. And a little known fact with Robert Liston, he's actually attributed to the only surgical case with a 300% mortality rate. If you've never heard this little quick story, he was actually known as one of the fastest surgeons of the time. He could amputate a leg in 2.5 minutes. Unfortunately, during this rendition, as he performed the operation, he actually amputated the fingers of one of his young assistants. And then, as someone in the crowd seen this, actually went into shock. So they fainted from fright when they seen the fingers go flying, and they died from shock. So that's how he got attributed to his 300% mortality rate. His assistant died of sepsis, his patient died of sepsis, and the lady died of shock from fright. And then this is the ether monument that is actually present in Boston today. It actually bears no man's name. As you can see, that was a heated debate on who was the actual first physician to discover the anesthetic uses. Was it Dr. Wells? Was it Dr. Crawford Long? Was it Dr. Morton, since he had a successful demonstration of it? So it doesn't bear any man's name, but it does recognize the important event. So with that being said, we spent a little time understanding the history of hand washing and its importance in contributing to anti-sepsis technique. It was before its time. Unfortunately, Mr. Semmelweis wasn't recognized in his lifetime for that and died. But Dr. Lister understood the importance of germ theory and applied that to his work and developed anti-sepsis technique, which greatly reduced the mortality rate from operations during that day. And then lastly, we've seen the advent of anesthesia. And with all these three things we do every single day now can be attributed to these forefathers in our field. So hopefully you learned a little something this morning about our history and where we came from. And these individuals allow us to do what we do today freely. And with that, any questions?
Thank you so much, Dr. Smith, for this great lesson in history. Does anybody have a question? Please raise your hand, and I'll bring the microphone to you. Yes.
Thank you so much for the presentation. That was amazing. I don't have a question, but that was a very fascinating summary. I enjoyed it so much. I would just request, if you ever had time, I would love for you to make another one, a follow-up for this, maybe leading to subspecialties in surgery. I would love that. Thank you.
Yes, sir.
Great, thank you.
I enjoyed it also. I think another follow-up topic, if any other residents wants to pick up on it, would be Halstead and his contributions to surgery. He started the first general surgery training program and the first to use rubber gloves, is from my brief memory.
Yep.
But all surgeons love surgical history, and I think you did a very good job, and thank you.
Thank you. Any other questions or comments before I check for online questions?
Tips. I gave y'all 20 minutes.
Okay, give me 1 minute to get up here. No questions. Okay, it doesn't look like we have any questions online. Thank you so much, Dr. Smith. This was excellent.
Yes, thank you.